Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and today is one of the follow-ups in a series that we are kicking out for information on market venue retail locations, uh, retail programs. A lot of folks refer to them as the Walmart program. It's only one of many options that are available. So as we get updates from the different carriers and from the Walmart initiative, we are recording additional pieces of information so you can stay up to date on the different opportunities you have in making this marketing initiative part of your overall marketing plan. You'll notice in the software package there is a section for questions. Please make use of that section. And until we find we answer most of the questions throughout the course of a presentation, we want to make certain that you have all the detail that you need in order to make this a profitable use of your time, both today's recording and the initiative itself. What we'll do as well is start with a wee bit of level set about Premier Marketing. We're a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform with offices across the country. And we act as an insurance wholesaler working with independent insurance agents such as yourself, offering contracts for insurance carriers at the highest possible commission levels with recruiting contracts available to those who qualify. We do so through a full portfolio of products that include the Medicare programs that take care of the shortfall in the traditional Medicare program, including Medicare Advantage plans, Medicare Supplement plans, standalone Part D prescription drug programs, all of which are part and parcel of a retail initiative. But we also offer a full portfolio of life insurance and annuity products, including final expense life insurance, pre-need programs as well, and long-term short-term care insurance and disability income plans, and ancillary benefits, including dental, vision, hearing products, critical illness cancer plans, hospital indemnity, accident, and telehealth programs. Those also can be good points of discussion in any retail initiative as well. The Medicare Advantage programs include all the national carriers and many of the strong regional carriers that can make a difference for you in your market and help lead to success in your retail activity. And that same philosophy carries over into the prescription drug programs where those national carriers are there for you for your use through our organization. Medicare Supplements, broad portfolio of products, different marketing programs that can come into play to help you there. And we see in many of the rural areas in retail, these are very strong components in that marketing initiative too. When we speak of ancillary products in each of those categories, the national carriers are there for you for your use, not only to draw additional marketing opportunities for you, including through retail, but also, of course, the additional income streams for you and your agency. But most importantly, a means to satisfy the needs of our prospects and clients in each of those key categories where they need the help for one reason or another. We work with many of the carriers that give us an opportunity to do things in person and virtually. And this is important when we speak of retail because many times during our times at the pharmacies or the centers of influence that we use as our hubs for this marketing initiative, we're gathering leads and following up on sales opportunities. And sometimes that's best done on a virtual basis, and we'll talk about the tools you have in place to do just that. We've trained people to understand the electronic means of dispersing the information and replying to it, but it's not just us. Most importantly, the providers of the care, the doctors, the specialists, the hospitals, the dentists, heck, even faith-based organizations deliver their product in a manner of speaking digitally as well. And so folks are very much more comfortable in handling the disbursement of that information and the response to that information electronically. So having those tools, either through the carriers or through our organization, as we'll talk about in a moment, can make a huge difference for you. So as we speak of the opportunities you have in selling through market venue retail locations, we want to make certain that folks realize that this is just part of an overall marketing plan that you develop as you go into AEP, where the bulk of this activity may take place, but also part of an overall year-round program. Because if you work retail just to occupy that spot in the store or that center of influence, you're going to be a tad disappointed in most cases, because we want to make it a part and parcel of an overall marketing plan that you'll really see the difference as to how you would qualify that as a success or a not so successful venture. So you have a number of options available to you. We speak of Walmart a lot, but look at some of the different carriers that are offering programs either individually or as part of that Walmart program. And if they're part of that Walmart program, that may give you also the opportunity for additional marketing opportunities with that organization through retail or other initiatives that may be available for you. And then, of course, there's always the opportunity of creating your own retail opportunity. We'll talk about that briefly. When we look at one of the first ones that's messaged there, we see that Aetna came out with some information for us here this last week, talking about their retail program and how it can be very beneficial to you and very cost effective. It is a program that works with a number of different stores and locations in addition to the Walmart opportunity, a large number of available stores throughout the country, and it includes a large number of labels that are out there. Keep in mind, much as what we see in all parts of our life, where it seems like we have a bringing together of brands in a manner of speaking, you do find some corporate initiatives that have more than one label. And so that may be the label that is important to you in your neck of the woods, in a different part of the country or a different market. It may be the same boss organization, so to speak, but it may be a different label when it comes to the pharmacy or grocery store. It gives us a ton of opportunity with Aetna to take our message beyond just the retail opportunity. Because while you're working in a number of different possibilities in CVS stores, where some of them are larger than others and offer different services than others, you have, of course, other pieces of information made available to you through their Medicare resource centers that can help you become much more adept at both handling questions, making presentations, marketing your programs through the detail they make available to you. There are charges in the Aetna program, and if you work in the retail locations that are, well, the CVS stores, there is a $275 investment for the product and the shipping and handling, but the possibility of a $100 reimbursement on those purchases. Note that word, purchases. You're buying this material and it's yours. So you can use it in a multitude of different locations as you create other marketing opportunities through your preferred target market. And it enables you then to look professional in each of the locales that you are utilizing for your marketing activity. If you choose to work in one of their other partners, the other brands that are made available, the price is less, and you still have that reimbursement credit made available to you. It is a grand opportunity once again for you to reach out into the community, take advantage of programs that are set up for you in retail, but also use that material across the board for other opportunities in your marketing plan. You've even got some pull-ups that are available for you in both English and Spanish, which is very important in many of the markets that we visit with, particularly if you are bilingual. It's not exactly a good idea to put out a whole bunch of information in Spanish and you don't speak it. So you have, however, the opportunity to draw that attention. And if you choose to partner with another agent in the area that is bilingual and you're sharing some of the marketing programs and expenses, this is a grand opportunity to double up on your outreach into the community. It also gives you the opportunity to create a kit of material that you have available through their resources, including many of the things that you're asked about on a regular basis. The ABCs of Medicare, Medicare 101 program, particularly if you're in Some of the pharmacies, they're going to ask a lot about, well, what about Medicare Advantage and PDP programs? You have that opportunity to have these already created. You don't have to recreate the wheel type of material that is approved for use in the community and is available for you moving forward. It also has within it the opportunity for you to help drive folks to your different locations. If you are owning your store, be it a CVS or one of their other partner organizations, this is a great way for you to mail in an area around that store, a 3 to 5 mile radius. I would talk to store management to see how far they feel that they draw people to their location and take that into consideration with your mailings. That is an opportunity for them to drive additional people to you because they're aware of the fact that you're helping to bring people into their stores and their locations. But it's also a way for you to have people contact you directly. Even though it's Aetna labeled, it's John Dubas, insurance agent, labeled at 214-450-9639 with a TTY number as well. So it's a great way for you to cement your relationship while you're driving additional traffic to yourself. It also is a system where Aetna has the programs in there for you to set up your events and report that activity. Remember, in each of these retail campaigns, outside of perhaps one that you're doing for yourself by yourself, every one of these organizations is going to want to know, well, how'd you do? Plus, they need to watch the compliance angle to make certain that you have everything reported ahead of time, registered ahead of time as a selling opportunity. You're going to want to do that, and each of these different locations may have a different time frame that's necessary for you to complete that ahead of time. So as we look at the ways that you can do some of the things that come in there, we want to make certain that we've created the requests for you to make certain that you have the opportunity to perhaps engage in the store of your choice, but you also then have the opportunity to make certain that you've registered and you're utilizing their software system to do what's required of you in order to make certain that you're going to get that credit and you're being compliant. So one of the first things that we want to make certain that you realize is a lot of these store locations, well, scratch that. These store locations are dictated and driven by your broker manager. So if you have a good relationship with your Aetna broker manager, you need to be talking to them now about enlightening them as to your desire of working this campaign with Aetna. If you don't know who your Aetna broker manager is, well, it means you might not be doing as much business with them as you thought, or we need to make certain that you know who they are and we do an introduction for you. So that's what your Premier Agent Success Manager, your Premier Marketer will do for you as well. Some of what you have to do has to be done now. So talking about this opportunity with the broker manager, scheduling the events, making certain that you have all the material that's there, that's necessary for you, that you wish to do, well, you have it. And then you go in and you visit with the store and the management to make certain that they realize what your intentions are. Your plan is to help drive business to the store and to yourself, and how you can help each other do that. And then make certain that you are handling the steps that Aetna requests of you to make certain that you're being compliant during the events as well. So the scheduling of those locations, showing up, checking in, checking out, as a matter of fact, when your shift is over, and then recording the activity to make certain that you stay in compliance and keep yourself in the running for that reimbursement. It's one of the things that it's important for us to know, that just because those labels may be out there with the different locations, it doesn't necessarily mean they're all going to be participating in a program. So you can't just go to a location, slap down some information and go forward with it. We want to make certain that we are following the rules, but also doing so not only for that reimbursement, but also to maximize the support that you're going to get. Aetna asks that these all be um, set up at least 10 calendar days prior to the advertising or the event itself. And let's keep in mind that in order to do so, we're going to have to be contracted and certified with Aetna for that in advance of that calendar requirement. So some of the things that we talk about with Aetna also may apply to some of the other carriers, including Anthem and Amerigroup, where we don't have all of the 2021 detail, but we suspect a lot of it's going to be the same as what it was last year, where you're going to have to be certified with their product portfolio. The shifts will be flexible. In the past, here recently, it's been Roundy's and Kroger locations. They don't require an investment on your part. They are outside of the time, which is your most valuable asset. So those 20 hours a week. If you're working in a Kroger location as part of the Anthem, Kroger's going to help market you with it. And they do ask that you have weekly sales reports as well. It's important that you don't miss out on a week of reporting because, hey, you're going to get behind and you're going to go, what did I do that week? Once again, these locations and the support for the material is all handled through the area market manager. So you don't have that information about who that person is. We need to set you up with it. But if you do, we also need to make certain that they are helping you with store procurement and support of your marketing activity. They are going to make certain that you have some really neat tools in order to be successful, including that standing floor banner that, hey, Aetna says it's worth $107 at least. Some of the other carriers say more. You got a locking lead box so you can do some passive recruiting in a manner of speaking. You got the tablecloth that's there, the brochures that stands that are there, the name badge, and the plexiglass tent. When we look at Baylor Scott and White, which is a carrier here in the sovereign state of Texas, mostly central to northern Texas, they have some locations with different CVSs as well. This is something that if you're contracted with Baylor Scott and White, we want to make certain that you're working with the market manager to become involved in this program so you're aware of the opportunities, and we make certain that you've completed your portfolio certification as soon as possible so we can involve you in those programs. Blue Cross Blue Shield in Texas, well, that's one of the 5 states that's part of the HCSC contract here in Texas. It does require portfolio certification with Blue Cross Blue Shield in the state of Texas. They standardize the dates in which you participate, which are Tuesdays and Thursdays, 10 to 2. These are through different Walgreens locations. There are limited numbers that are available. So once again, you need to be visiting with your area marketing management to see if you are a possibility to partake in these programs. And that means the quicker you do that, the better. If you don't know who that is, we need to make certain that we do that introduction too. When we look at Bright, they've done some expansion in 2021 from 2022. Many of these carriers are doing product expansion as well for 2022, but Bright has also purchased a couple of organizations, making a presence in California. Their program, while we don't have specifics, we once again suspect that it will be the portfolio certification. They're all going to ask that. It's a do-it-yourself locations in many circumstances, and we want to make certain that if you are interested in offering the Bright portfolio as your lead carrier, that you're working with your area market manager to make it work. United Healthcare, we're supposed to be getting some additional information this week on it, but much of it will mirror last year's requirements where the portfolio certification is necessary along with an additional module on community marketing. You're going to be utilizing the United Healthcare Be Connected system to both register the event and report your activity. And that is activity that is set up 3 weeks in advance. So you saw some of the other carriers that are talking about 10 days to 2 weeks ahead of time. United is asking for more time ahead of time. And part of the reasoning for that is the marketing support they want to give you in order for it to be successful. You have flexibility to create your time schedule as to when you are working at kiosk in the different locations. They have asked last year to have at least 15 hours a week. We suspect that again this year. Um, there are multiple store brands, logos that are participating in United Healthcare's campaign. But once again, this is dictated, your participation and the store availabilities, through the area market managers. So we want to make certain that you don't miss out on that. If you don't know who your area market manager is, we need to help you with that. Finally, when we talk about Walmart details, we have some updates from a week and a half ago when we did a webinar on these programs, where you see a lot of similarities year over year come for this coming year from last year, where they're asking for at least 20 hours a week and at least 3 days a week. They highly recommend that you have more than one agent in a store. I know a lot of folks don't like to do that. They want to own their own store. Some like it because then you can maximize presence in the store. They do ask that all of the reporting and checking in with the pharmacy happens the day of the activity. So you're checking in as you go on to start your shift, you're checking out as you go out, and you have at least 2 of the participating MA carriers in the market to staff the store. Obviously, they'd like for you to have more of those as well, but keep that in mind. And you'll notice a whole bunch of the companies that we've already talked about are participating in Walmart as well, in addition to their own campaigns. So sometimes you can kill 2 birds with 1 stone. Some folks will say, well, gee, can I work Walmart? Can I work one of the carrier ones? Absolutely. If you want to, however, abide by and follow the requirements for the staffing. So if you've got one that requires 15 hours a week for a carrier store and 20 hours for Walmart, you got 35 hours in the store. So keep that in mind. The biggest differences that we're seeing in this campaign from last year is the cost of the store. It's gone from $500 to $1,500. It is a fee that is required as soon as you get to the store. So it's not one of those, well, hey, it's just June. I don't start in this until October. I can pay later. No, that's not the way Walmart and HPH works. So you're going to have to follow up on it. There is not a reimbursement this year. The 90% reporting threshold is to make certain that you have right of first refusal for your store moving forward for next year. The program is initiated where you begin on October 11th and it closes on the 7th of December. There's talks about making some locations available past that. No details on that yet. With this, however, you've got to be certain that you have not only created your profile in their software system if you haven't done it before, updating it if you had, making certain that you have certified or recertified with the carriers prior to your deadline of 9/10, September 10th in this. And keep in mind, sometimes for the certifications to show up in these systems, in the MarketPoint HPH system, sometimes takes 2 weeks for that to happen. So you have to have, in essence, your certifications with your MA PDP carriers in that market done normally in the last week in August. It also gives you then the opportunity to create time to do the rest of the training that you have in the modules that Walmart requires. So the training for how you conduct yourself, signing off on a code of conduct, all that certainty that you need to have in the system, making certain that it's all updated, needs to be done in advance. That right of first refusal round, well, that's complete. So the folks that have been in those stores have those back should they spoke up and said, yeah, I want me some of that, and they paid for it to a degree. And it gives you then the opportunity then to maintain that store, which is part of, Walmart's all over the country. We're asking that you market the products through ourselves. It doesn't mean all your contracts have to be with us. It makes it easier for us to give you some additional support if it is, but it is that choice model where you have multiple carriers here. most commonly across the country, that's Humana and United Healthcare. So they're the ones with footprints in every state. But you will see in other markets that may include, well, some of the other companies we talked to or talked about, Aetna, Anthem, some of these other carriers, to make certain that they're there for you to use. Cigna, I'll throw that out there too. It is that, once again, the details that we laid out for you with the different requirements for participation and the additional rounds that come out with store availability. Second round starts on June 8th, runs through the 25th. First come, first served. And as those stores are claimed, then a third round will come about after the 4th of July for 10 days for some of the additional stores. Walmart wants as many stores staffed as possible. They realize that they are taking their piece of the pie, and some of the folks that are running these programs realize that there may be more stores empty than there was in the past, but you have the opportunity there for a number of stores. That $1,500, that can be looked at a number of different ways. Walmart's going to do some additional things to help you market, but it's also the opportunity for you to realize your value and take into account some of the increased commissions that you have with Medicare Advantage programs for 2022. It gives you the opportunity then to thoroughly market a store by perhaps bringing in some additional agents to work with you side by side, your peers, and make certain that if you have a hierarchy, that might be a store for your agency. So there's a number of things that you can do to address that cost. And keep in mind, that's about 3 new to Medicare apps in the Medicare Advantage world. So entirely conceivable. For some folks that do 100 plus apps in those stores, it's an additional $1,000, but it's all those monies you'd miss if you didn't do that. There are a number of carriers that are participating. These are the folks from last year. You may see some changes in this, some additions. There might be one or two that say, no, don't want to do it this year, but generally they're into play. When you have an opportunity in different areas where some of your preferred stores may not be available for you anymore, or if you recognize a center of influence that can be a great partner for you, use them in your own retail campaign. And you do a lot of what you would do with the carrier specific initiatives or Walmart in supporting your own campaign. The challenge with this is you don't have some of the Walmart support, or perhaps even some of the carrier support. You can bring them in, of course, but careful about how you limit your possibilities there. It also then gives you the opportunity then not to have to worry about continuous reporting, which I got to tell you, that's not a bad thing, because it helps you keep track of what you're doing and helps you recognize that there's some things that you might have to change in order to be successful through the course of your initiative. So all said and done, in any of the campaigns, you need to make certain that you've got your choice of location identified and dibs put in. You've got your contracting and certification underway or completed. You're doing some training to improve your odds of success as well, and incorporating that into your success strategy. Some of the recommended trainings, of course, are all the carrier certifications. Many of them have additional modules for you to do for marketing in these type of circumstances. If you are hand in hand with a carrier in one of their campaigns, boy, make certain you know how to work their electronic enrollment systems, because it'll make your life so much easier for you and give you that opportunity to pile on some additional compensation by completing the different health risk assessments that are out there, where those carriers are paying you 40 to 60 bucks just to set that up. There are some additional things that you can do also, not only for the carriers, but for the Walmart or for your own, and that's making yourself aware of some of the different marketing support you can do in the surrounding areas to make yourself more successful in your chosen site. And that includes being aware of and becoming proficient in the extra help, low income subsidy programs, the Medicare savings programs, so you can make certain that you're maximizing the value for your prospects and clients, because if you don't, someone else is going to, and they're not going to stay your client too terribly long. We also strongly suggest that you make yourself an expert in the Medicare Center programs that are offered to Premier and Integrity Partners agents, contracted agents, that give you a number of abilities to maximize your time. And that also rolls into the fact that be aware of the plan finder, the Medicare.gov guide that's out there, and how many people will look at that as an opportunity for a source of truth. It's had some challenges over the last couple of years since they changed vendors, but knowing how to work it can be a big value to you. And it then also brings into account some of the different marketing things that we talked about for grassroots marketing community. What kind of presentations do you have available that you can set up additional marketing events there as well in conjunction with your retail initiative? So the different Medicare 101 programs, the programs that help you explain Medicare Advantage, prescription drug programs, med subs. There are different training programs on those. The ABCs of Medicare, however you want to phrase it, having that material available to you already set up, and we have that for you, can make a big difference in setting up additional marketing activity now and into the future, because it gives you then the track to follow in visiting with those centers of influence that you are making aware of your presence in a retail location. We've also got a really cool presentation to help you and remind you with optimizing your referrals, because that's applicable not only with your prospects and clients that you're looking to help with enrollment in one program or another, but it's also a track to follow in order to compound your different marketing activities with centers of influence in the community by just working referrals. We don't want you to put all your eggs in one basket. We want you to plant your flag and become aware of all the possibilities around your space. And that includes identifying those centers of influences, the churches, the senior centers, the nutrition sites, senior living facilities, provider sites, different places where you can go to spread your information about your presence in retail, but also the opportunities you're offering to help educate the people that come to their facilities as well. Some of the things we're going to do at Premier, of course, we can help you contract with multiple carriers quickly by creating your agent profile, insurance pay, doing it all electronically. With Medicare Advantage programs, many of them have an electronic link. We'll send you directly to expedite that process. But this is a great way for you to add on other carriers, particularly in the ancillary world, life insurance and some of the other programs, to make certain that you have those multiple choices available for your prospects and clients through you as their insurance agent. We also offer discounted E&O for qualified agents. What makes you a qualified agent? You got a contract with us. However, this is a program that doesn't add you to a blanket E&O policy for one carrier or another. This is a program you buy and you own. It satisfies that E&O requirement that just about every insurance carrier has now, and it will satisfy that requirement no matter whom you're contracting through. Obviously, we'd like it to be through us, but this is going to cover you no matter whom you have that contract through. And we help you with discounted continuing education through our relationship with WebCE to make certain that your license stays in play, and you can add to your own benefit structure by enrolling yourself in a modified guarantee issue disability income program, where you're paid a commission on that, enhancing your own benefit structure as well. Much as where today's presentation is being recorded, we have recordings of different marketing programs out there available, including some of the things we've been talking about with the centers of influence, talking about grassroots community efforts, faith-based organizations, provider marketing, different programs out there like that. These, much like today's presentation, are posted on our website at premiersmi.com, but also on our YouTube channel as well. That electronic tool that I mentioned a little bit earlier, Medicare Center, if you're not familiar with it and you're contracted with Premier, shame on you and shame on us. It's an all-in-one universal login from any device that gives you access to a CRM for your business. It gives you the ability to stay compliant by sending e-scopes out by email or by text and storing them for that 10-year period if you sell them or not, which gives you an opportunity to sell down the road throughout the year by accessing that material. But it then gives you access to 3 different quoting engines: Medicare App, Medicare Link, CSG. Those are powered by Connecture, Sunfire, and CSG, and can be very, very helpful to you, including a means to help you cross-sell. So you go in a household and they've got an MA program they're happy with. You've, in your detail that you're giving them, reinforces their thoughts that, hey, I'm in the best program I can be in. Well, you can then use this program to suggest a hospital indemnity program to fill in the blanks. Great way for you to cross-sell. And remember, as you grow your book of business and as you maintain your book of business, which is almost as important in many circumstances, it gives you then that opportunity to drive up your persistency, because the more products you have in the household, the higher your retention is going to be. And let's face it, that's our salary year over year. We also have a place on our website that can help you with placing all those additional incentives and trips that you have for certain product. Now, that doesn't apply to MA and PDP products because max comp set, we've got the 22 numbers on that already that we can get you as well if you don't have that. But those programs can help you qualify for Premier incentive programs as well, which last year was going to be a cruise, turned into cash. That's probably the way she's going to go moving forward. We do also have different lead programs, a community list for you to help you smile and dial. You can't do that for MA and PDP. Once again, boy, I'm a master of negativity here. Mattering nabob of negativity, like Spiro Agnew said a long time ago. But it is something you can do for other product, and a lot of folks are approaching the T65 market a little differently, or growing number of folks, because for dental programs, you're seeing a change in the premium from 64 to 65. And it's a great incentive for them to take that initiative, add on dental coverage, and then that puts them in your book of business so you can speak to them on a year-round basis and approach them for a review during the annual election period, or if they have a special election period now, doing it now. We talked about those community marketing programs that are out there. Different carriers do help with prospects, particularly the MA programs, PDP programs, the ones you have a relationship with. We do offer internet leads and direct mail support, and I've talked about that referral program. When we speak about mail support, it is based on production, but it drives down that cost so you can do things consistently, get full value out of it. And there's a program for health programs and one for final expense. So you can actually qualify for 2 different mail programs through your production with our organization. And you're doing so through preferred lead vendors. We do that because we vet the information that's available, make certain that you're staying in compliance and protecting you in that fashion. For those who don't want to absorb the full cost of a mail campaign immediately, we do have 2 different direct mail response programs where you can purchase never contacted before direct mail response to kind of fill in the gaps in some of your prospect pool that you need available. Keep in mind these costs will vary according to the time of the year, the product, your area. Some areas have better response rates than others. So keep that in mind, but that's available to you. That internet program is for Facebook leads for both final expense and Medicare. Those costs are available to you as well. Very nominal, but then it is a more immediate response in some of the direct mail campaigns. You do a mail campaign where you are dictating the entire mailing. It's about 3 weeks before you receive a response. The mail campaigns where you're buying the returns, well, they may have come in a week ago. These are programs, it's much more of a microwave mentality. It's quicker for you on a response. Referrals, once again, if you're not asking people As Lyndon Baines Johnson said, vote early and vote often. If you're not doing it in that fashion, you're cutting yourself short. All that said and done, we want the opportunity to work for you. We're asking for your business, and we're asking you to refer other agents to us as well. And we'd appreciate that a great deal. If retail is something you're considering or you're already doing, let's talk about how we make that part of your overall marketing program, and we do it now because some of that activity can help you here in June, July, August, September, as we roll into the time period where retail is most commonly put into play. But hey, we've got bills to pay in the meantime. A lot of this can help you now as soon as we get up and going with it. So you can reach us for more detail at 1-800-365-8208. Speak with your marketing manager with Premier. If you don't have one, we'll set you up. And of course, you can reach us at our website as well, premiersmi.com, where you can request people contact you or get additional information in that fashion. So all that said and done, I want to thank you for the time that you spent with me here today. Your time is your most valuable resource. I thank you for spending that with us. For those of you that have worked with us in the past, we appreciate that business and that partnership. And for those of you that are about to do so, I thank you for that opportunity as well. So all said and done, until we're able to visit again soon, I thank you, and we look forward to talking to you most quickly